Hi, this is Dr. Karen Becker, and we're going to discuss feline hyperthyroidism. Hyperthyroidism in cats is the most diagnosed endocrine disorder in cats. And in cats, what happened? The thyroid is a butterfly-shaped gland that sits at the base of your cat's throat. When the thyroid gland overproduces thyroid hormone, the condition is called hyperthyroidism. And it's incredibly common with kitties over the age of 8. 50% of cats that acquire hyperthyroidism end up wanting to eat a whole lot more. 90% of kitties that acquire hyperthyroidism end up having weight loss because their metabolism is upregulated from the amount of circulating thyroid hormone that's in their bloodstream. Most of the tumors on the thyroid glands of cats are benign. Those are called adenomas, but rarely thyroid carcinoma, which is true cancer, can occur. The good news is most of the tumors that cause feline hyperthyroidism are benign. There are some other symptoms that can come about besides weight loss and increased appetite. Cats can sometimes have high blood pressure as well as vomiting. Their heart rate, temperature, respiration rate can increase because their metabolism has been increased. So those can be notable symptoms, as is hyperactivity. A lot of people will call my practice and say, you know, I have a 13 or 14 or 15-year-old cat that has suddenly become very active. In fact, surprisingly active. They're jumping around and they're moving and they're keeping me up all night and they're really active. And sometimes that symptom, in conjunction with weight loss or increased appetite, can signal that your cat is developing hyperthyroidism. The great news is it can be diagnosed with a simple blood test through your veterinarian. There are 3 traditional treatments that are usually offered to manage hyperthyroidism. The first option is medical management, and medical management revolves around administering a pill. The pill is called methimazole. The trade name is Tapazole for cats. Providing methimazole in oral form to cats twice a day helps block thyroid peroxidases. It inhibits thyroid hormone from being produced, so the circulating amount of thyroid hormone is diminished in your cat's body. And what research shows is most cats, in fact 87% of cats on methimazole, will have normalized thyroid levels within a couple of weeks of being on this medication. Interestingly, 87% normalize with twice-day dosing, and only 54% of cats have shown to normalize with once-a-day dosing. So we do recommend that you give methimazole twice a day if you're picking this form of therapy. Side effects of methimazole therapy can include gastrointestinal problems, so cats can have GI upset, and that can cause them to throw up. We can also see, actually rarely, but can happen, a really intense allergic response to using methimazole in terms of treatment. Cats, after one pill, can develop a very intense facial itch that can cause the need for the owner to have to discontinue therapy. I have found with kitties that have the gastrointestinal side effects that sometimes using a compounded transdermal ointment that can be rubbed on the inside of your cat's ear, oftentimes you can avoid the gastrointestinal side effects if indeed your cat has that rare symptom pertaining to using that medication. Other rare side effects include decreased platelets and increased liver enzymes by using that particular medication. More aggressive traditional thyroid therapy revolves around either surgical thyroidectomy, which is surgically removing the benign tumor from your cat's thyroid gland. This surgery should only be performed with a surgeon that's very skilled and has performed many of these procedures, because even though this particular form of therapy is curative, which I like, there are some complications, some surgical complications that can arise if the surgery is not done excellently and 100%, which means the parathyroid glands, which sit on the thyroid glands, if the parathyroids are accidentally removed, that can cause a whole host of really negative complications. So I like surgical removal as my first treatment option for animals, because using methimazole therapy, although it can be beneficial, if your cat has a negative side effect from that, you end up having to find a different option. And certainly the surgical option is great because it's cured, your cat's done, and can move along being thyroid problem free, which is wonderful. If you opt to use the medical management, the methimazole form of therapy, you have to have your cat on that pill for the rest of your cat's life, and you have to do really consistent blood monitoring to make sure your cat's levels are remaining stable. One complication that can arise after medical management has been successful with the pill form of methimazole therapy is that once the blood pressure has been normalized in your cat's body, The kidneys can oftentimes end up struggling, and you can end up with secondary kidney issues. Hyperthyroidism is well known to mask underlying kidney problems in cats. And while the cat is having high blood pressure and a lot of blood flow to the kidneys with an unregulated thyroid condition, the kidneys appear to be fine. But once the cat is well managed, which means the blood pressure is normal in the cat's body, elevating kidney enzymes can become a real problem. So it's important that if you choose to use oral medical management, that your doctor is not only monitoring thyroid levels, but also kidney values, which can become a secondary problem pretty quickly. If your cat has negative side effects from methimazole management, certainly surgical removal of the benign tumors would be my next recommendation because it's curative. No more pills and the problem's done, but the procedure has to be performed by a very skilled surgeon. There is another form of traditional therapy called radioactive iodine. Radioactive iodine is exactly what it sounds. Specialized radioactive approved facility where you take your cat to does one single injection of I-131, which is a radioactive form of iodine that attacks the disease portion of your cat's thyroid gland. Now, common sense would maybe tell you that injecting a radioactive substance into your cat is a little spooky, and I would agree with that. This is an approved form of therapy not only for people, it's a very common form of therapy for cats. There are some downsides. Number one, you're injecting radioactive material into your cat. Number two, it's very expensive. And number three, it can be stressful because you have to leave your cat at the radioactive approved facility for 7 to 10 days until your cat's levels of radioactivity drop down to where it's safe to take your cat home. Kind of sounds a little scary. Many people have had great success using it, but that is a form of treatment that I would certainly encourage you to pursue all of the ups and downs because there are positive and negatives associated certainly with that particular form of invasive therapy. Last but certainly not least, I would have you consider investigating integrative medicine. Of course, being an integrative physician myself, I would tell you that there are a whole host of natural things that can be provided to your cat to help manage hyperthyroidism if the disease is caught early. In fact, in one very small study, 8 out of 13 cats had clinical resolution of their signs of hyperthyroidism using clinical homeopathy or classical homeopathy. And so it's important that if you're interested in pursuing treatment for your cat's thyroid problem, my first recommendation is to start with classical homeopathy or some other form of natural therapy that could completely avoid all the side effects of using some of the more traditional approaches.